Good morning, and thank you for joining our COVID-19 briefing this week. As has been the case, the Tuesday briefings have been canceled on election days, but we were too excited by some of the great things happening this week to wait until next Tuesday to announce them. In addition, this will be your first opportunity to meet our new Acting Health Commissioner, Dr. Cheryl Bedigal. She'll be joined by Ms. Gail Carter-Hamilton from our COVID Containment Division, and Ms. Jessica Kalm from our Public Health Preparedness Program. Following their prepared remarks, we will provide those remarks in Spanish. Then we will open the floor to questions from the press. Now let's get started. Dr. Bedigal, please meet the press. Press, Dr. Bedigal.
Good morning, everyone, and thank you for being here. Let's see if I can manage to do this. And I just first want to say how much I appreciate the work that all of you do every day. You are part of us getting the word out, and we really do this in partnership with you. So I just wanted to take a minute to just introduce myself so you know a little bit about me. I have lived here in Philadelphia since 1993, and I've worked for the health department for all but a few years since finishing my family medicine residency in 1999. I'm a family physician and a public health doc, and I saw patients at the city health centers for more than 12 years and served as a clinical director there. I left the health department for a few years and served as the chief medical officer of a large federally qualified and migrant health center in New Jersey, and then came back about 6 years ago to focus on prevention and public health with the Division of Chronic Disease and Injury Prevention. I've also done advocacy on access to quality, affordable healthcare for all and on gun violence prevention with the National Physicians Alliance, which is now part of Doctors for America. So back to COVID. So I'm going to be relatively brief with the numbers today, although I'm happy to provide any additional data if you'd like. But our 14-day average case count is now 200, and the weekly positivity rate has been below 5% since May 2nd. We currently have 261 people in Philadelphia hospitals, and we've had 43 deaths in the past week. We're not out of the woods yet, but we've seen clear improvement over the past few months as more and more Philadelphians receive their vaccines. And I cannot stress enough, as we talked this morning, that the vaccines make us safe. The CDC's announcement that masks are no longer necessary for fully vaccinated people has generated a lot of talk and a lot of anxiety. But at its root, it's great news. Based on the most recent studies, we can now be comfortable, finally, that people who are fully vaccinated are not only protected from getting sick with COVID, they're also protected from passing it to others. That means that if it's been more than 2 weeks since your second dose of Moderna or Pfizer, and you do need those 2 weeks afterwards as insurance for your immune system to develop immunity, or 2 weeks after your single dose of J&J, you can hug family members again without worrying about what might happen. It means that people who are vaccinated are safe regardless of what other people around them decide to do about vaccine. And that is huge in terms of rebuilding our social networks, which are so crucial to health and to the life of our city. But in a city that has seen disproportionate hospitalizations and deaths among our Black and Brown residents, and in which only 21% of our younger Black residents between 20 and 44 have had at least one dose of vaccine compared to 49% of all residents, we can't be satisfied that some of us are safe. So while we're going to go ahead and relax outdoor mask guidance, since we now know that COVID-19 is rarely transmitted outside, we're going to wait a bit longer to relax indoor mask rules. We're going to ask Philadelphians once more to commit to protect each other. Philadelphia's existing mask guidance will remain in force until this Friday, May 21st, which is the same day as a number of safer at home restrictions are loosened. So this Friday, May 21st, masks will no longer be required outdoors, including at outdoor gatherings, outdoor restaurants, and outdoor sports events and performances. You can go to a ball game without a mask. And this is, remember, for people who are fully vaccinated. Masks will still be required while in public spaces indoors. During the week of June 6th, we will review case counts, COVID test positivity rates, hospitalizations, and vaccine coverage rates to see if it is safe to further loosen our mask guidance. On Friday, June 11th, As long as those numbers continue to go in the right direction, we will announce that vaccinated people will no longer need to wear masks inside in most spaces in Philadelphia. If case counts or hospitalizations are rising or high, or if vaccination rates have not risen, we'll continue to require masks indoors until the situation can be reviewed again in 2 weeks. Regardless of the changes in mask requirements for people who are fully vaccinated, people who are not fully vaccinated should continue to wear masks when around others. We know that many people have been taking a wait and see attitude, wanting to see more data before getting vaccinated. But we have now been vaccinating widely for over 6 months, and we have fully vaccinated over 120 million people in this country. So for those who have been waiting, putting off visits with loved ones, hugs, and ball games, we encourage you to talk to your friends and neighbors who've gotten their shots and think about if you're ready to get yours and get back to doing what you love. We're making progress. We're seeing counts come down week by week as vaccinations rise, but we're still losing Philadelphians to this virus. With a safe and effective vaccine now widely available, we need your help to change that. So if you know someone who hasn't been vaccinated, ask if you can help them with a ride or help to find a vaccine site close by. You can use our online vaccine finder, or you can call 311 for help. And be gentle. The folks who are still waiting may have good reasons to be hesitant. We want to support each other and not judge each other. I wanted to remind everyone that on Friday, a number of safer at home restrictions are still on track to be relaxed. They're listed on the city's website. Then on June 11th, all safer at home restrictions will end. If folks continue to get vaccinated and we see cases and hospitalizations continue to drop, fully vaccinated people can go back to normal. No masks, no restrictions, back to doing everything they've missed. If that's not a reason to get vaccinated today, I don't know what is. So thank you very much.
Thank you very much, Dr. Bedigol. Next, I'd like to call Ms. Carter Hamilton. If you would go ahead and unmute yourself, you have the floor now.
Good afternoon, and thank you, everyone. Thank you for having me today. I'd just like to highlight a few things. Since we now have the green light to vaccinate the school-aged children aged 12 to 15, I wanted to speak on a few topics as parents are considering summer programming for their children. The COVID-19 vaccine is very important. We cannot predict who will get seriously ill from COVID-19, but what we do know is that science tells us that the Pfizer vaccine is highly effective in preventing severe illness in adults as well as children. And we know that getting vaccinated will keep children out of the hospital. What we do need is all of your help. We need everyone's help to get these teens vaccinated. Currently, we're in the middle of Teen Week, a collaboration with Black Doctors 19 COVID Consortium, the School District of Philadelphia. And our goal is to try and engage the 12 to 15 age group with fun events and some of our vaccine clinics so that we can engage them. We engage with the teen Vax ambassadors who planned a lot of these activities at the vaccine clinics, and we want to see a great turnout. The city is also working with some organizations to try and make incentives available to try and get more adults also interested in the vaccines these weeks. This past weekend, the city was passing out 76ers tickets and gave away hundreds of tickets as incentives to get these people vaccinated. So what are the next steps? What we would really like is to make sure that everyone has access to all of the protocols for COVID-19. And the best way to learn about these is by checking the city's COVID-19 website. You can go to www.phila.gov/COVID. And if you'd like to talk to someone more about COVID-19 vaccine, you can email covid@phila.gov, or if you feel more comfortable speaking to a live person, you can call 215-685-5488, and someone will be very available to help you in your need at that time. Thank you so much, Jim.
Thank you very much, Ms. Carter Hamilton. Ms. Kaum, if you would go ahead and unmute yourself, you now have the floor.
Good morning, everyone. The health department is invested in making vaccination services available to all of our residents, and especially those who are highly vulnerable, including homebound persons. I would like to acknowledge all of the great work that other organizations have been doing over the past several months to provide in-home vaccination services and to advocate for the need for these services. Their work has been and will continue to be invaluable to this effort. We've been working with these and other organizations to develop a program that will allow us to, number one, identify Philadelphians who are homebound. Number two, identify vaccine providers who have the capacity and interest in providing in-home vaccination services. And number three, refer people who are interested in receiving vaccine to one of these providers safely and securely, and have those partners get some of our most vulnerable residents vaccinated. We've been quietly piloting this process for the past several months. The past several weeks. I'm pleased to announce today that we are ready to formally launch this homebound vaccination program. So to summarize, individuals can enroll in the health department's registry, and then the health department will make referrals to approved COVID-19 vaccine providers that are able to provide in-home vaccination services. These providers will follow up directly with the contacts to schedule an in-home vaccination appointment. Our goal is for this process to happen as quickly as possible, but it may take 1 to 2 weeks to get an appointment scheduled depending on overall volume. In addition to the fire department, approximately 20 other providers have already responded to us with their interest, and 6 have completed the process to receive referrals, with several others also in progress. We will continue to work with representatives from the disability community to ensure that this program meets the needs of this vulnerable community, and to ensure that best practices identified by one provider can be shared with all providers. People who are interested in registering themselves or persons in their care can visit phila.gov/COVID or call 215-685-5488. In the coming days, we'll be making sure that we get this information out to service provider agencies, community-based organizations, and other partners so that they can assist in raising awareness and getting people signed up in the registry. We have done outreach to all currently enrolled COVID-19 vaccination providers. However, if there are any providers that are interested in joining this effort, they can email vaccines@phila.gov. Thank you.
Thank you very much, Ms. Khan. Next, we will turn over to Ms. Zelly Colon, who will present our remarks in Spanish. Zelly, you have the floor.
Buenos días. Lo siguiente es una breve introducción sobre la doctora Pergol. He vivido en Filadelfia desde 1993 y trabajado para el Departamento de Salud Pública, excepto unos años desde que terminé mi residencia en el 1999. Soy médico de familia y salud pública. He visto pacientes en los centros de salud de la ciudad durante más de 12 años y fui director clínico. Dejé el Departamento de Salud Pública por unos años y serví como director médico de un centro de salud federalmente calificado inmigrante en Nueva Jersey. Regresé hace 6 años para centrarme en la prevención y la salud pública con la División de Prevención de Enfermedades Crónicas y Lesiones. Ahora de vuelta a COVID. Hoy seré relativamente breve en los números, aunque me complace proporcionar datos adicionales si lo desea. El recuento medio de casos de 14 días es ahora de 200 y la tasa de positividad semanal ha estado por bajo de 5% desde el 2 de mayo. Actualmente tenemos 261 personas en hospitales de Filadelfia y hemos tenido 43 muertes en la última semana. Aún no hemos salido del bosque, pero hemos visto una clara mejoría en los últimos meses a medida que más y más filadelfianos reciben sus vacunas. El anuncio de la CDC de que las máscaras ya no son necesarias para las personas totalmente vacunadas ha generado mucho discurso y mucha ansiedad, pero en su raíz es una gran noticia. Basándonos en los estudios más recientes, ahora podemos sentirnos cómodos de que las personas que están totalmente vacunadas no solo están protegidas de enfermedad con COVID, sino que también están protegidas de pasarlo a otros. Eso significa que si han pasado más de 2 semanas desde su segunda dosis de Moderna o Pfizer o su dosis única de Johnson & Johnson, puede abrazar a los miembros de la familia de nuevo sin preocuparse por lo que podría suceder. Esto significa que las personas que están vacunadas están seguras independientemente de lo que otras personas a su alrededor deciden hacer con respecto a la vacuna. Y eso es enorme en términos de reconstrucción de nuestras redes sociales que son tan cruciales para la salud y para la vida de nuestra ciudad. Pero en una ciudad que ha visto hospitalizaciones y muertes desproporcionadas entre nuestros residentes negros y marrones, y en lo que solo el 21% de los residentes negros entre 20 y 44 años han tenido al menos una dosis de vacuna en comparación con el 49% de todos los residentes, no podemos estar satisfechos de que algunos de nosotros estamos salvos. Así que mientras vamos a seguir adelante y relajar la guía de máscaras al aire libre, ya que ahora sabemos que COVID-19 se transmite fuera, vamos a esperar una poca más para relajar las reglas de máscaras interiores. Vamos a pedir a los filadelfianos una vez más que se comprometan a protegerse unos a los otros. La guía de máscara existente en Filadelfia permanecerá vigente hasta este viernes 21 de mayo, el mismo día en que se aflojan una serie de restricciones más seguras en el hogar. El 21 de mayo las máscaras ya no serán necesarias al aire libre, incluyendo reuniones al aire libre, restaurantes al aire libre y eventos y actuaciones deportivas al aire libre. Todavía se necesitarán máscaras mientras están en espacios públicos interiores. Durante la semana de 6 de junio, revisaremos los recuentos de casos, las tasas de positividad de las pruebas COVID, las hospitalizaciones y las tasas de cobertura de vacunas para ver si es seguro aflojar aún más nuestro guía de máscaras. El viernes 11 de junio, mientras esos números siguen yendo a la dirección correcta, anunciaremos que las personas vacunadas ya no tendrán que usar máscaras en el interior en la mayoría de los espacios de Filadelfia. Si los recuentos de casos o hospitalizaciones están aumentando o son altos, o si las tasas de vacunación no han aumentado, seguiremos requiriendo máscaras en interiores hasta que la situación pueda ser revisada de nuevo en 2 semanas. Independientemente de los cambios en los requisitos de máscaras para las personas que están totalmente vacunadas, las personas que no están totalmente vacunadas deben seguir usando máscaras cuando estén cerca de otras. Sabemos que muchas personas han estado esperando y viendo actitud, queriendo ver más datos antes de vacunarse, pero ahora hemos estado vacunando ampliamente durante más de 6 meses y hemos vacunado completamente a más de 120 millones de personas en este país. Para aquellos que han estado esperando, posponiendo visitas con sus seres queridos, abrazos y juegos de pelota, te animamos a hablar con tus amigos y vecinos que han recibido sus fotos y pensar si estás listo para conseguir el tuyo y volver a hacer lo que te gusta. Estamos progresando y viendo estos recuentos bajar semana a semana a medida de que aumentan las vacunas, pero todavía estamos perdiendo filadelfianos por este virus. Con una vacuna segura y eficaz ahora ampliamente disponible, necesitamos su ayuda para cambiar eso. Así que si conoces a alguien que no ha sido vacunado, pregunta si puedes ayudarlo con un paseo o para encontrar un sitio de vacunación cerca. Puede utilizar nuestro buscador de vacunas en línea o llamar al 311 para obtener ayuda. Y sea amable, la gente que todavía está esperando puede tener buenas razones para dudar. Queremos apoyarnos mutuamente y no juzgarnos el uno al otro. Quería volver a pensar a todos que el viernes una serie de restricciones más seguras en el hogar todavía están en camino de relajarse. Aparecen en el sitio web de la ciudad. Luego, el 11 de junio, todas las restricciones de Safer at Home terminarán. Si la gente continúa vacunándose y vemos que los casos y hospitalizaciones siguen disminuyendo, las personas totalmente vacunadas pueden volver a la normalidad, sin máscaras, sin restricciones. Volvamos a hacer todo lo que han perdido. Si esa no es una razón para ir a vacunarse hoy, no sé qué es. Ahora él actualice las restricciones más seguras en el hogar en caso de que sea necesario. Actualizaciones de las restricciones más seguras en el hogar. Debido a la vacuna, disminución de nuevos casos notificados y el aumento continuo de las vacunas, la ciudad ha anunciado una mayor relajación de las restricciones actuales de Safer at Home. El viernes 21 de mayo entrarán en vigor los siguientes cambios. Los restaurantes todavía con 50% capacidad máxima o 65% capacidad máxima si cumplen con los estándares de la ventilación mejorados. La distancia entre los respaldos de las sillas se reducirá de 6 pies a 3 pies. El requisito de que el alcohol se sirva con alimentos terminará. Los requisitos de máscara siguen vigentes y para aquellos que no están sentados a comer o comen. Oficinas. Se permitirá operar sin límites de densidad, pero los requisitos de máscara todavía están en vigor. En las tiendas, minoristas, boleros, museos, bibliotecas, se permitirá operar sin límites de densidad, pero los requisitos de máscara todavía están en vigor. En los gimnasios y piscinas cubiertas, se permitirá operar al 75% del límite de ocupación o a las 15 personas por cada 1.10 cuadrados. El tamaño de la clase de ejercicios tendrá un límite de 25 personas. Las reuniones y teatros interiores se permitirá operar al 50% del límite de ocupación. Debe imponer un mínimo de 3 pies de distancia entre personas de diferentes grupos. En reuniones al aire libre y teatros, si el sitio tiene asientos fijos, se le permitirá operar al 50% del límite de ocupación. Si el sitio no tiene asientos, se permite un máximo de 33 personas por cada 1.0 pies cuadrados. Debe imponer un mínimo de 3 pies de distancia entre personas de diferentes grupos. En eventos cubiertos se permitirá operar al 25% del límite de ocupación. La comida debe servirse solo en la mesa. Se permitirá un máximo de 250 personas, incluido el personal, si no habrá música, baile o alcohol. Se permitirá un máximo de 150 personas, incluido el personal, si habrá música, baile o alcohol. Eventos al aire libre. Puede operar al 50% del límite de ocupación sin límite en el número de personas que asisten. Piscinas al aire libre pueden operar sin límites de densidad ni capacidad máxima. En los casinos pueden operar 50% capacidad máxima o 75% capacidad máxima si pueden cumplir con los estándares de ventilación mejorados. Debe imponer un mínimo de 3 pies de distancia entre personas de diferentes grupos. El alcohol se puede vender a los clientes en las máquinas de juego. Los requisitos de máscaras siguen vigentes. Además, la ciudad anunció que todas las restricciones de Safer at Home terminarán, con la excepción de los requisitos de la máscara, el viernes 11 de junio. Ahora, las palabras de Gail Carter Hamilton. Buenos días y gracias por invitarme. Dado que ahora tenemos luz verde para vacunar a los niños en edad escolar de 12 a 15 años, quería hablar sobre algunos temas, ya que los padres están considerando programar verano para sus hijos. La vacuna COVID-19 es importante. No podemos predecir quién se enfermará gravemente de COVID-19 y la ciencia nos dice que la vacuna Pfizer es altamente eficaz en la prevención de enfermedades graves en adultos y niños. Vacunarse mantendrá a los niños fuera del hospital. Necesitamos la ayuda de todos para vacunar a los adolescentes. Estamos en medio de Teen Week, una colaboración con Black Doctors COVID-19 Consortium y el Distrito Escolar de Filadelfia para tratar de vacunar al grupo de la edad de 12 a 15 años con eventos divertidos en algunas de nuestras clínicas de vacunas. Nos comprometimos para un grupo de embajadores adolescentes que planearon lo que querían ver en una clínica de vacunas. La ciudad está trabajando con organizaciones para tratar de poner más incentivos a disposición para ayudar a los adolescentes y adultos que estén interesados. El pasado fin de semana, la ciudad y los 70 Sisters regalaron cientos de tickets para las personas que estaban interesadas a ser vacunados para una incentiva. Estamos empezando a trabajar con pediatras en toda la ciudad para ver cómo pueden ayudar a vacunar a los adolescentes de la manera más fácil y accesible. Para próximos pasos, la mejor manera de aprender sobre la vacuna COVID-19 es revisando la página web de COVID de la ciudad en phila.gov/COVID. Si desean hablar con alguien sobre la vacuna, envíe un correo a covid@phila.gov o llame al 215-685-5488. Ahora las palabras de Jessica Cobb. El Departamento de Salud está invertido en poner los servicios de vacunación a disposición a todos los residentes y especialmente a aquellos que son altamente vulnerables, incluidos a personas que les es difícil salir de sus hogares. Me gustaría reconocer todo el trabajo que otras organizaciones han estado haciendo en los últimos meses para proporcionar servicios de vacunación en el hogar y abogar por la necesidad de estos servicios. Su trabajo ha sido y seguirá siendo invaluable para este esfuerzo. Hemos estado trabajando con estas y otras organizaciones para desarrollar un programa que nos permita identificar a personas en Filadelfia que no les es fácil salir de su casa, identificar a los proveedores de vacunas que tienen la capacidad y el interés en proporcionar servicios de vacunación en el hogar y recomendar a las personas interesadas en recibir la vacuna a uno de esos proveedores de forma segura y que esos socios tengan a nuestros residentes más vulnerables vacunados. Hemos estado pilotando silenciosamente este proceso durante las últimas semanas. Me complace anunciar hoy que estamos listos para lanzar formalmente este programa de vacunación en casa. Para resumir, las personas pueden inscribirse en el registro y luego el Departamento de Salud hará referencias a proveedores de vacunas de COVID-19 aprobados que son capaces de proporcionar servicios de vacunación en el hogar. Los proveedores harán un seguimiento directo de estos contactos para programar una cita de vacunación en el hogar. Nuestro objetivo es que este proceso ocurra lo más rápido posible, pero puede tomar 1 o 2 semanas para obtener una cita programada dependiendo del volumen total. Además, el cuerpo de bomberos, aproximadamente 20 proveedores, ya nos han respondido con su interés y 6 han completado el proceso para recibir referencias y varios otros también están en curso. Continuaremos trabajando con representantes de la comunidad y discapacitados para asegurar que estos programas satisfagan las necesidades de esta comunidad vulnerable y para asegurar que las mejores prácticas identificadas por un proveedor pueden ser compartidas con todos los proveedores. Las personas interesadas en inscribirse o personas a su cargo pueden visitar a phila.gov/COVID o llamar al 215-685-5488. En los próximos días nos aseguraremos de compartir esta información con las agencias de proveedores de servicios, organizaciones comunitarias y otros socios para que puedan ayudar a crear conciencia y conseguir que las personas se inscriban en el registro. Hemos hecho divulgación a todos los proveedores de vacunación COVID-19 actualmente inscritos. Sin embargo, si hay algún proveedor que esté interesado en unirse a este esfuerzo, pueden enviar un correo electrónico a vaccines@phila.gov. Muchas gracias.
Thank you very much, Zelly. We'll now move to Q&A. Reporters are asked to limit their questions to 3 or fewer. We understand that you probably have many questions for Dr. Bedegolf, but for our first round of questions, we ask you to stick to the topic at hand of COVID-19. If we have time for a second round, I'll open the floor up to other questions, but do want to make everybody aware that Dr. Bedegolf may not be able to answer many questions about the situation at the medical examiner's office, as there is an ongoing investigation and obviously still many outstanding questions. First up, we will go with David Malandra from Philly Sports Network. Go ahead, David. You should be able to speak.
Got a couple of questions for you. One, I just want to make sure I'm understanding this. You say May 21st, masks are for Philadelphia for outdoors are lifted. The Phillies are home starting this Friday against the Boston Red Sox. So for those fans going to those games this weekend, will masks be required at Citizens Bank Park?
So for outdoor, starting on Friday, masks will no longer be required. We'll continue to very strongly recommend that anybody who has not been vaccinated, meaning they're not 2 weeks post their last vaccine, continue to mask to protect themselves, but we will no longer require outdoor masking.
And my final one for you would be, on Sunday, the Sixers are going to be hosting their playoff game at the Wells Fargo Center. What about for those fans going to the playoff game on Sunday at Wells Fargo?
So I'm about to reveal the difference between my baseball knowledge, which isn't so terrible, and my Sixers knowledge. Wells Fargo Center is outdoors?
Indoors.
Indoors.
Indoors. Indoor masking will continue to be required. People do need to keep their masks on. And that's really important. I think there's been a little bit of confusion between the CDC guidelines, the Pennsylvania guidelines. But as is also true in New Jersey, we are keeping indoor masking for now in Philadelphia.
All right, thank you very much.
Thank you very much, David. Next up, we have Manny Smith from CBS 3. Manny, you should be able to unmute.
Doctor, thanks for joining us. I just want to make sure I got that clear. So for the outdoor masking requirement, it's not required as of Friday for those who are vaccinated, but for those who haven't been vaccinated as of Friday, it's not required but recommended.
So as of Friday, there will no longer be a mandate to wear a mask outside in the city of Philadelphia. We're continuing to recommend that people who are unvaccinated protect themselves. But that's, a public health and medical recommendation to them. It's just understanding, if you're vaccinated, if you are 2 weeks after your last vaccine, you're safe. That's what the CDC was really telling us. They've looked at the data, and even if somebody decides to waltz past you with no mask on and they're not vaccinated and maybe they were exposed, you're safe. So you no longer need to worry about what other people are doing, which I think is great for mood in Philadelphia. If you're not vaccinated, you're not safe. So please, please, please get vaccinated. That's our message. But outdoors, you don't need a mask. In terms of the mandate, nobody does, but we really would strongly recommend that if you're not vaccinated, you keep that mask on. Indoors, masks stay on for now.
Thank you for clarifying that. When Governor Murphy rolled this out in New Jersey, there's a lot of discussion and consideration given to retail workers or ticket takers and having to enforce or, kind of like mitigate and figure out if someone's vaccinated or not. Is there new guidance coming from the department on that? Or do you have specific guidance or advice for people who will find themselves in that situation?
So part of the reason, there are a number of reasons we made this decision, but a piece of this is that there's not really a realistic way for businesses, retail workers, ticket takers, et cetera, to know for sure. These are paper cards. So if somebody wanted to fake one, it would be easy. So rather than create a system in which that's on them to enforce, we're basically saying outdoors, where we're pretty confident that there just isn't a lot of spread outdoors, we're not going to require masks. Indoors, we will. Now, even in an outdoor venue, if a business is running an outdoor venue, they could decide, a private business could decide to do what they decide to do if they want to require something. But we are keeping the indoor mandate for now. And a lot of the reason for that is to protect those essential workers. They've been going to work throughout. They are not able to limit their own risk right now. Many of them are still kind of a little hesitant or waiting to see. I do really want to encourage those folks. I think we now have solid data that the vaccines work, and to go ahead and get vaccinated, use this extra month to get that vaccine. But that's kind of the thought process. We don't want to create an enforcement nightmare for individual businesses.
Sorry, Manny, I'm muting you again. There you go.
Thank you. And for my last question, Dr. Bengal, as a journalist and as a parent, knowing that younger people haven't been vaccinated, what's the advice in that situation? Like, hey, if I take my kids to the playground and there's kids who are unmasked as of Friday, all of that is okay? Or what if teenagers are going out for the weekend and they're all hanging out on my porch? What's the best way to approach that?
Yeah, so for younger kids who remain unvaccinated, we want them to keep their masks on. Now, you can mitigate risk, right? So if you're outdoors, your risk is lower. If you know that, for example, you have a 5-year-old and you have a lot of trouble keeping that child's mask on and you really want them to play with other children, take that play outdoors. But try to get them to wear a mask still. It's still, we need our younger kids to continue to mask. For the teenagers, it really depends if they're vaccinated yet. So, the fully vaccinated teenager, great. And I think for all parents of teenagers, this is a thank goodness moment, because it's really been tough for parents to keep their kids apart. So, for the kids who are partially vaccinated, maybe they've had one dose, they're not done. Outside, please, they're going to be safer. If you can get them to keep those masks on, great. But you're going to do as much risk mitigation with the kids as you can.
All right, thank you very much.
Thank you so much, Manny. Next, we'll move to Jack Tomzek from Metro. Jack, you should be able to unmute now.
Thank you, Dr. Bedigal. A question about the mask, another question about the mask mandate. You just said that the vaccinated people are protected and safe, and that's what the CDC was saying. So why wait until June 11th to lift indoor masking for vaccinated people if they're safe now?
So as I was just saying, it's an enforcement nightmare to know who's vaccinated and who isn't. So if we say that vaccinated people don't have to wear their masks indoors, we know that it's very likely that some people who are not vaccinated will end up not wearing masks indoors. We're going to put those frontline workers at risk. Now, the solution to that, I think, is not to try to police vaccinations, because as I just said, it's virtually impossible to do. It's for us to do a really big push and get all those frontline workers vaccinated to the extent that that's possible. So, the way to keep people safe is to vaccinate them. And I think that's the bottom line here.
Mm-hmm. And one follow-up on Manny's question about children, and what would you tell parents? I mean, say if a parent's fully vaccinated, they don't have to wear a mask outdoors or in certain gatherings, but their child does. So like, how do you communicate that?
I think about parenting. I mean, I have 3 sons. A lot of times we find ourselves doing things that we might not do if they weren't looking, that we're going to do a little bit more carefully because they're looking. I live on a busy block. There's a lot of traffic here. And for many years, as long as my kids were at home, I never crossed in the middle of the block because I knew that they might be watching me and I never wanted them to cross in the middle of the block. Now that they've left home when I'm in a rush, I have to admit, sometimes I cross in the middle of the block, but for years I walked all the way down to that street corner. And I think of masking the same way. Yes, parents, great, you're vaccinated. You no longer need that mask outside, put it on. It's going to be, up to you as a parent, obviously, but if you're trying to get a 7-year-old to wear a mask, it might be easier if you're still wearing yours. And parents are going to make individual decisions that way. If they know their child is going to be more likely to wear a mask if they keep their own on.
Okay, thank you.
Thank you very much, Jack. Next up, we have Laura McChrystal from the Inquirer. Laura, you should be able to unmute.
Hi. Regarding the continuing decline in coronavirus case rates, I'm wondering, would you attribute that, Dr. Bedigal, solely to vaccination, or do you think there's other factors? Kind of why do you think it's continuing to decline?
So nothing in public health is ever just one thing. So there's probably multiple factors involved, but I think the biggest one is vaccination. Everybody's, heard lots of discussion about herd immunity and whatever that number really is, which we could debate. We're not there yet, but we do have enough people vaccinated that I think that is helping to drive down case rates, certainly helping to drive down hospitalization rates and keep more, especially elderly people who are vaccinated at higher rates, out of the hospital. So I think it's a big factor.
Okay. And have the, week by week, we've seen vaccination, the number of vaccines being given continue to decline. Has that continued like in the past week? And, what are you doing? Can that be turned around, or do you think it will continue to decline?
Well, some of the there are a couple of reasons for the steep decrease, right? I think there was a period during which people were desperate to get appointments, and we did see a steep decline as more vaccine became available. The Johnson & Johnson situation didn't help us, but we have not exactly leveled out, but the steep decline isn't happening as much. So I think this past week, we're going to end up somewhere in the range of 60,000 doses given, just similar to the previous week. So it's not a dramatic drop. And there is a huge amount of work, much of which has been led by Jessica Calm, who was on earlier for the city, and then by Black Doctors Consortium, by our local hospitals. There's a big push to get more people vaccinated and to get vaccine where people are. The teen clinics have also been a big factor trying to get our teens vaccinated. And I think that's another population where we have a fair number of people who really are interested in vaccine. So we're just kind of getting that started up. So there are lots of efforts to try to get more people vaccinated as quickly as we can.
Okay, and lastly, do you have, a goal in mind for, where you would like the vaccination rate to be by June 11th?
So the reason we didn't give specific numeric goals, and we talked about this a lot internally, was that it's the combination that we're looking at. What is the positivity rate? Is it staying under 5%? It has been consistently under 5%, but are we seeing that overall case rates continue to come down? Are vaccination rates going up, or are they stalled? What's happening in our hospitals? We're going to look at all of that together. So, if one of those numbers isn't as good as the other, but everything else is looking great, we may go ahead. We have to put all that information together. So, I think our biggest push still has to be to get as many people vaccinated as possible before then, because that's really the thing that's going to make the biggest difference.
Okay.
Thank you very much. Thank you very much, Laura. Next, we will go to Martin Pratt from Philly, Your Black News. Martin, should be good to go.
Thank you. Two questions. First question is, can you explain, I think there's some confusion in general around if you get vaccinated, you are still capable of being infected with COVID-19, but what is the purpose of vaccination, even though you can still be infected with COVID-19?
So there certainly have been cases of infection after vaccination, and I think we've all read those reports. It turns out to be very, very uncommon. And for people who do get COVID after they're vaccinated, most of them have a much, much milder syndrome. Not all of them, but most of them have a much, much milder syndrome. And their carriage, meaning the amount of time that they are carrying the virus in their body and could potentially give it to somebody else, is quite brief. So, some of this is driven practically. Like in public health, you can't necessarily drive risk to zero. So you're trying to drive it down so that it's low enough that it is reasonable. We leave the house every day, we get into our cars and drive. We know there's some degree of risk, but we don't want to get into a car that doesn't have brakes, for example. So that's the thing you can do with vaccine is dramatically reduce your risk of catching COVID. And if you catch it, getting very sick, ending up in the hospital, or God forbid, dying of it, and passing it to somebody else. So it's all three of those things together.
Second question is, do you share the feeling that there will have to be a booster shot in a year?
I share the feeling that there will likely need to be a booster shot at some point. I don't think we know the interval yet. I'm certainly hoping that it's longer than a year. We haven't seen any indications of waning immunity yet. So it's something we're all watching very closely. And, as is very clear now, we need to plan for the worst and hope for the best. So if we didn't need a booster for 5 years or 10 years, that would be a beautiful thing, but I don't think we want to count on that.
Could you also, one question, could you also give or maybe I guess Friday or next Monday, give us some sense of how the teen week went? Can we get a report from the office?
Yes, we are very interested in looking at that data ourselves. The reports I've heard so far are very encouraging. Lots of teens turning up, teens crying. I mean, this means means so much to everybody, but especially to teens who really thrive on being with each other. It means a lot. We want to look at the numbers, in terms of demographics and who we're really reaching, figure out if there's groups that we're not reaching well and make sure we do reach them. So all of that is in the works.
Right, I'm still waiting for the TikTok video from the department.
It could be a while, but.
Thank you very much, Martin. Next, we will go to Maggie Kent from 6ABC. Maggie, you should be good to go. Maggie, are you with us still? All right, while she's having some technical difficulties, it looks like we will go to Pat Loeb from KYW. Pat, you have the floor.
Thanks. Dr. Bedigal, would you call Dr. Farley's resignation a setback for the city's COVID-19 response?
You know,
Hi, thank you for taking my question. I wanted to talk about.
Sorry, Maggie. Oh, Maggie.
In the Black
Maggie. Oh, Maggie, hang on a second.
From 21 to 44, where is the breakdown there, whether it be accessibility, etc.?
Maggie, I'm sorry. We started on another question. Hang on to that for a second. I'll get back to you as soon as Pat's done. I'm sorry. I apologize, Pat and Dr. Bedigal. You want to start that question again, Pat, for a clean sound bite, you can.
That's okay. Dr. Bedigal, go ahead.
So, I mean, two things. You know, we lost somebody with tremendous experience and commitment to this COVID response. And I think, you know, we need to acknowledge that. Dr. Farley undoubtedly saved thousands of lives here in Philadelphia. The other piece of it is that fortunately we have a tremendous team of people in the health department who are working on this response, and everybody is, you know, united in making sure that the response continues, that it continues to be strong and effective. I had been brought into the COVID team. I mean, I was part of the response from March through August, and then was brought back after Johnson's resignation because we needed additional people as part of the response at the very beginning of February. So, you know, I'm familiar with the team, the response, so that, you know, that's also helpful, but it is just a tremendous group of people. So I'm really confident that we will continue to make very good progress against this virus, and that we won't let this keep us from saving lives the way we need to.
Okay, and are you a candidate for Dr. Farley's job?
So I have been doing this job for a few days. I have not really had time to sleep or eat, and I have really not given that question any thought. There hasn't been a moment.
Okay, thank you.
Thank you very much, Pat. Maggie, try number 2. You should be able to unmute now if you want to give that a shot.
Okay, thank you.
Thank you.
Pat. My question is regarding the low number of COVID vaccines distributed to the Black community from 21 to 44 that you mentioned, and where do you see that breakdown happening? Is it in accessibility, trust? Is it in communication? Where do you see the breakdown, and what is being done to fix that?
So I think a piece of it is that for a long time we were asking younger people to wait their turn, to let us get to the older people who are more at risk. A piece of it is probably related to being an essential worker, you know, difficulty getting time off work and so on. A piece of it, I think, is related to trust. A piece of it is that depending on where you live in the city, it may seem like there's much more pressing issues than COVID. So I think it's lots of things together. As I said, in public health, it's rarely one thing. But we are doing a really big push to try to make sure we reach, especially that group. We want to reach everybody, but especially, you know, the younger folks who are maybe more likely to be going to work every day, you know, at risk if they remain unvaccinated, really to make sure that we are reaching them. And that's the full court press.
Maggie, if you have some more.
Thank you. I'm set.
Okay, thank you. All right, I see no other hands raised and about 10 minutes left in our scheduled time. I'll give folks a couple minutes if you want to raise your hand for a second round of questions. All right, it looks like we've got a few coming in. We will start off with Martin Pratt from Philly Your Black News. Martin, you may unmute yourself.
Okay, I think, am I unmuted?
Yep, you're good.
Okay, cool, thank you. Do you share the general perception that now COVID-19 is airborne? And if you do, doesn't that change how we address the herd immunity concept?
So I share the perception that there is some component of airborne transmission. Is it the majority of transmission? Probably not, but there does appear to be some component of airborne transmission, particularly in low ventilation environments. I think herd immunity is a little bit of a red herring, but the reason that I'm interested in looking at all of the numbers together is that the risk that each of us face is a combination of factors. So if I walk into a room full of 1,000 people and I'm unvaccinated and there is one person with COVID in that room, there's some risk to me. Now, if that person's wearing a mask, that's a much lower risk. If that person is not wearing a mask and they are singing loudly and they are strolling toward me and, circle around me, risk goes up, all of those things together. Of course, we don't live our lives that way, right? When I walk into it, well, hopefully I'm not walking into a room of 1,000 people right now, but when you walk into a room, you don't know who does or doesn't have COVID. You do have a sense of how many people are in that room. Are the windows open? Are they wearing masks? So the way I'm imagining risk or picturing risk as we do this is how many people are likely to have COVID? That's our case count, right? And we know that our case count is an undercount. We know that not everybody who has COVID necessarily is going to get a test. So then we're looking at positivity as a way of knowing, like, what percent of cases are we really picking up? If positivity is going up, we're probably missing more cases. Positivity, like 2%, which is where we were today, that's relatively good, but we're picking up most of the cases. If we start seeing hospitalizations rise, but case counts don't rise, we're missing cases, right? So we're looking at all of those factors together as a way of making up for the fact that we don't have a way of looking at every Philadelphian each day and saying, okay, today there are 730 people. No, we don't know that. So we use all those numbers together to try to get a sense of where we are, because the odds that if I'm really walking into a room of 25 people, the odds that one of those 25 has COVID determines how safe or not safe I am if I'm not yet protected. Did that answer your question? I know it's a little bit of a...
No, yeah, it did. And I want to have a quick follow-up. I promise to be quick. A couple of answers ago, you mentioned that, about reading cases of persons that got vaccinated and then got COVID. And one of the cases I was talking about specifically was the Yankees. And they were, as you said, in a closed room. The coach got it, and 8 players got it. The 8 players were asymptomatic. The coach really needed some help. In that scenario, they were in an enclosed environment. And I think that's kind of the issue that I think it's hard to wrap our heads around, is if we reopen and everybody goes back inside and there's no open windows and it's an honor system, we don't know if this person's fully vaccinated or not. I think that's where there's a disconnect in the public's mind.
Yeah, and a piece of the reason that we're saying we want to look at this the week of June 6th, the idea of making a decision for June 11th. My fear is that people will hear the CDC guidance, rip off their masks and say, we're done, great. If I ask you, can you hang on till June 11th? It's not that long. You can do it. And can you help to make sure that the friends that you have who aren't vaccinated get what they need? It's a finite ask. If I say we're going to keep masks indoors in Philadelphia, I don't know that we can get people at this stage to stay with us. The CDC made a big announcement. It's fine.
Right.
If everybody just lets go and takes their mask off now, we're going to have a big problem. My hope is that if we can hold on for another month, drive those case counts down some more, keep the positivity low, drive vaccinations up, I've made it much less likely that unprotected person stays unprotected, but also that they're put at risk. This is all, our best bet based on the current evidence and our knowledge of how people work. But that's the thinking.
Got it. Thank you.
Thank you very much, Martin. Next up, we'll go to Manny Smith from CBS 3. Manny, you should be able to unmute now.
Thank you. Doctor, we just heard from the governor of New Jersey says that he's going to announce some new incentives to encourage COVID-19 vaccinations. I know you talked a little bit about that earlier, and with the Sixers event tickets that were given out last weekend. What are your thoughts on that? Are there discussions directly between the city and other partners to have broader vaccination incentives? And is this even something you're discussing with the state?
There are discussions about incentives. Incentives seem to be very effective. And, we are announcing things as we have them. We'll just ask Jessica, do you have anything else you would want to add to that?
I don't think I have anything else to add. Thanks, Cheryl.
I know nothing is set yet, but what kind of incentives, have you been discussing, or have you seen be, encouraging for people to get a shot locally?
So we're talking with partners about what might be possible. So I don't have an answer for you yet, but it's certainly something that we think is a good idea and would like to be able to drive forward.
Okay, so we should expect some sort of announcement regarding incentives sooner or later from the department?
When we have something to say. I mean, I don't have an exact date on that. It's something we're working on, but we're not there yet.
All right, and last question, was there anything that you wanted to say? I know you've been a long-time employee of the health department, but just about the MOVE investigation. I don't know how employees internally have been feeling with all this news coming out. And obviously, their work has been central to what is at debate in the city. So what has been that internal feeling, and is there any additional comment that you had on MOVE?
I think we all, there's not a lot I can say about the internal investigation, really, but certainly that this is a department with a tremendously dedicated, hardworking staff that cares deeply about Philadelphia and Philadelphians. And I think we all feel this and are saddened by it.
Annie, are you good now?
All good. Thank you very much.
Thank you very much. We've got about 2 minutes left, so I'm going to shoot over to Laura McChrystal from the Inquirer for our last question. Laura, go ahead and unmute yourself.
Hi, I'm wondering, I know how much you can say about the investigation related to the MOVE remains, but I'm wondering, have you, since stepping into your new role, had a conversation with leadership at the medical examiner's office, and will you have any role in the investigation as it unfolds?
So I have had conversations with the leadership of the medical examiner's office. And I would say, I would separate, the investigation needs to be independent. I think we all recognize why that is. That's separate from looking at policies and procedures and seeing where we need to improve. And that latter part is where I see my role.
Okay, and just to clarify that quickly, because I know the investigation is also supposed to include, to some extent, a look at how to improve the medical examiner's office. So, so are you saying, in other words, that you're already taking a look at that separately and not really waiting for that to unfold?
So I do not want to do anything that would interfere with the independent investigation. However, as part of how the department operates, we need to make sure that all of our policies and procedures are what they should be. So I'm being very careful not to interfere in any way, but need to look at those policies and procedures now rather than, because I do not know how long the independent investigation will take. And in the meantime, we have to go on.
Okay, thank you.
Thank you very much, Laura, and thank you very much to all of our assembled press. We have reached our hour limit, so I'm going to close this down for today. Thank you again, and we look forward to seeing you all again on Tuesday for the city's normal weekly briefing. Have a good weekend and be safe.